Kansas City just has a vibe that has taken off here in the last 5 to 10 years, I would say.
It's got an amazing culinary and art scene. You can see a play at the Kauffman Center for the Performing Arts, or you can go to the Crossroads to an art gallery. It's got all the sporting events.
I think we're really lucky because it's one of the best places to raise kids in the country, has some of the best schools in the country.
I also love that you have the opportunity to live in open space as far as if you wanted to live in the country versus the suburbs or the city.
Research Medical Center, being a part of HCA, means that we have access to resources and capital and a part of a broader network.
We have over 180 hospitals throughout the United States and United Kingdom. In Kansas City, we're part of HCA Midwest Health with over 120 points of care. What that means is you have the ability to work with your colleagues across the health system to advance neurology and stroke care. Research Medical Center consists of 4 campuses. We have our main campus, which is the main hospital. We have our Research Psychiatric Center, which is a 100-bed behavioral health hospital. We have our Brookside campus, which contains a large freestanding ER and surgery center, and our Research College of Nursing.
We actually are very near very distinct zip codes. We have one of the highest per capita zip codes about 3 minutes away, and then we have a homeless population about 3 minutes away. So we get a very mixed, diverse group of patients here at Research.
Our patient population can be extremely complex. However, with that complexity, it allows our specialists to utilize their skills to their maximum benefit in delivering excellent care. I would say the medical staff here at Research is extremely collegial. We have great interactions between multiple specialties. In the emergency department, that's a huge benefit. Our medical staff takes pride in being a quaternary referral center for not only our HCA network of hospitals here in Kansas City, but all regional local hospitals that refer.
While working at Research Medical Center, you have the opportunity to work with a number of high-quality systems. So you have neuroradiology, which is one of the best that I've seen, including our Level 1 Trauma Center with the multiple trauma surgeons that are available there. So you really have the sort of breadth and specialties that you need to provide the care that you want to provide.
The stroke program at Research Medical Center has been in place for a number of years, first as a primary stroke program and then advanced to a comprehensive stroke program in 2017-2018. With the Comprehensive Stroke Center, we also advanced into subarachnoid hemorrhage as well as treatment with coiling and clippings.
Some of the benefits of having Blue Sky Neurology cover acute stroke is the fact that Blue Sky Neurology is already at a lot of our other hospitals. So they provide telestroke care at those hospitals. So by providing in-house stroke care at Research Medical Center, it allows a continuity of care that we wouldn't otherwise have.
So at Blue Sky, our culture is one of really supporting our neurologists as much as possible. And I think around that, we can build wonderful and amazing programs. So first is we have put the clinician at the center. And I think in having that opportunity to really have neurologists and specifically neurohospitalists thrive and do what they've trained to do and what they're experienced to do, we believe that that leads to success.
Some of the benefits of having a neurohospitalist cover stroke 24/7 is the fact that we just provide high quality care for our patients 24 hours a day, 7 days a week. We have patients flown in from all over. In fact, this hospital system is a 7-hospital system, with this being the hub where the patients are flown.
The different specialties within neurosciences work very well together. We have not only a neurovascular team that we work with for patients with mechanical thrombectomy needs, but we also have neurosurgery available for those patients that are needing surgical intervention. They do share a lot of information through rounding as well as individual consultation between colleagues. We also support other programs. We do assessments for patients pre-procedure and then see them after procedures to be able to detect any neurological changes and hopefully prevent complications from stroke related to those procedures.
All of our medical staff is highly engaged in supporting tertiary level programs such as our comprehensive stroke program, our Level 1 trauma program accredited by the American College of Surgeons, our Level 1 STEMI program, and other advanced service lines such as our bone marrow transplant program and solid organ transplant program.
There's something that draws you here. You're not here just for the mundane. It's the challenge of practicing at the top of your ability.
Our medical staff, because of the acuity of patients we see here, have very significant clinical competence, regardless of the service line. They're accustomed to seeing the complexity of patients here at Research, and that's why they choose to practice here with us, and we hope you will too.